course, one of the big discussions underway there in the UK is about vaccine access, distribution, of course, equity. The complexity of vaccinating millions of South Africans in rural areas is said to be the hardest part of the journey you will have to travel. South Africa has vaccinated just 1% of the population, the majority of whom are healthcare workers whose job it is to arrive at healthcare facilities. Even if this is the easy part, it isn't necessarily plain sailing. It's been said getting the vaccine to the rest of the South African population, especially those living in rural areas, will be the greatest hurdle of it all. Ian Lester is the CEO of Beyond, and we talk about the business of cold chain storing for vaccines and why this is important for South Africa. Very good evening to you, and thank you so much for speaking to us. Perhaps let's first start with what we're talking about here, about when we talk about Beyond cold chain storing vaccines, a business there of what is the concept exactly?
So we're thank you very much for having us. Well, firstly, we're not in cold chain storage. Beyond is an Internet of Things solution provider, and our role in the supply chain is to ensure that the cold chain is monitored to make sure that these life-saving products stay within the correct temperature band, and essentially ensuring that the cold chain is maintained from the manufacturer all the way through to the patient where they ultimately get the jab.
So why does this part of it, vaccinating people in rural areas, why is it more complex than those in the cities? Is it because of that?
Well, I think it's really a matter of the logistics of it. If one needs to understand the structure and nature of any supply chain, and let's just talk through the COVID or any vaccine for that matter. Vaccines come from manufacturers who are typically based in either the United States, Europe, or Asia. And they come into the country and land up in centralized depots, and then they go to regionalized depots. But from there, they need to go out into clinics and beyond that in what we refer to as outreach programs that then need to be taken into rural communities to get the product into the arms of the recipients. Now, when one understands that as a pyramid at the top from the central stores where they come in and arrive at the country and that distribution channel, the depth and breadth of that supply chain is an incredibly complex and difficult thing to manage. And it's very important that throughout the journey of that vaccine, that the temperature remains within a very strict temperature band to ensure that that product is not compromised in any way.
Okay, so how is Beyond involved with UNICEF to deploy vaccines, and how the doses are rolled out here in South Africa? Compare what you've seen to what you've seen internationally as well.
Sure. So as a business, we're currently, our technology is deployed in 77 countries. Our major clients are UNICEF, the International Committee for the Red Cross, the WHO, as well as the Pan American Healthcare Organization. And all day, every day, we monitor the temperature of vaccines and have been doing so for well over a decade. Immunization is not necessarily new. I think it's just something as a result of the COVID pandemic that everybody, it's becoming a daily topic. Your vaccines and cold chain, I think we're more familiar with it than we've ever been. In terms of our role in South Africa, we play have very close relationships primarily with the private sector. We're working very closely with the likes of Dis-Chem Pharmacy as well as Discovery Health in helping them to ensure that their cold chain is monitored and maintained. So at this stage, our primary role is really with the private sector. But of course, the private sector is working very, very closely with government in making sure that we get these vaccines into people's arms.
I mean, you're just looking at the J&J vaccine delay or saga. Are there opportunities to learn here? And given what you do, are there also opportunities for us to learn to acquire the skills and the technologies for what you're doing at your level?
Well, I think the J&J issue is a very different problem. That was an issue at the manufacturing level and had very little to do with the actual cold chain. But certainly as far as skills and competencies are concerned, I think as a South African business, we are a world leader in this space. In fact, we probably have been at this for longer than anybody else. As I said, we're deployed in 76 or 77 countries right now. So I don't think there's a challenge as far as skills or competency is concerned. And I don't even think we need to learn from anybody. I think we are teaching others. I think some of the challenges that we're faced with on a day-to-day basis in this country, not the least of which is interruptions in power supply, these things necessitate invention and coming up with solutions to solve these problems. So I think in many ways, as a South African business, Beyond is a leader, and we certainly, from the feedback we're getting from our customers globally, the fact that they use us means that I don't think we need to sit back and say, well, what can we learn? But rather, what can we teach other people around the world?
And I suppose the reason I'm mentioning the J&J vaccine, and if there's an opportunity to learn, and as much as I hear you say it's unrelated, but it's been said that there is an urgent need for pharmaceutical companies to share their vaccine technology and know-how in order to support a massive increase in vaccine production. I understand that it's about contamination, but I'm still keen to know, are there areas of convergence where we can learn, where we can improve?
Well, I think globally right now, I think there certainly are efforts around the world to share information. I think there have been challenges, not just with J&J, but several manufacturers on the production side. We've recently seen the announcement by Joe Biden that they're going to be procuring 500 million doses of vaccines to be sharing it with less fortunate and less wealthy countries. So I think there are certainly opportunities to learn and collaborate. And I think what COVID has done is truthfully removed the barriers and the boundaries as far as international countries are concerned. And there really is a global effort to solve the problem. And I think it's a practical collaboration, because everybody realizes that until the last person is vaccinated, and the head of the WHO said exactly this, until the last person is vaccinated, none of us are safe. And I think the reality is that the sooner we can get everybody vaccinated, the sooner we can get on with life and business. And truthfully, as per your previous piece, all variants need and the various strains need is unvaccinated people and time. So the race is truthfully on to get the vaccine into the most remote parts of the world, to make sure that we can get a handle on these variants and ultimately move on with life.
Thank you so much for speaking to us. Appreciate it. Ian Lester, CEO of Beyond, and he was talking to us about the business of cold chain storing for vaccines and why it's important for South Africa and its rural population.